housemaid knee. Two statement is given. Housemaid knee, also known as prepatellar bursitis, causes inflammation. Bursa. Superficial infrapatellar bursitis occurs in the inflammation of bursa around the insertion of a distal patellar tension coming from anatomy. So, if you know the anatomy, housemaid knee, what is the insertion and you can correct. So, answer, I take both statement are true. That is the answer. Next question is from surgery, that is achalasia cardia. What is the most common, what is the correct answer? Here type 1 contain loss of ganglion and neural fibrosis. Type 2 there will be esophageal compression. Type 3 there will be vigorous achalasia. Type 3 there will be only loss without loss of ganglion but there will be gangliositis. Type 4 there will be achalasia cardia commonly affected 30 to 40 years age with male to female ratio 3:2. So here I go to the answer all. So let's see. So it is the answer A, B, C, D. Everything is correct. Next question is about the penetrating injury left gluteal. It is also coming from anatomy. Here the question asked about tibial division of a sciatic nerve. So here what is the injury, which part will be defect? There will be weakness of the plantar flexion of the ankle joint because the sciatica division of a tibial nerve supplies all the gastrocnemius, soleus and tibialis posterior, all plantar flexor, plantar and grade 2 flexor. So that's why plantar part of the weakness will be happen. Now this question is from psychiatry. 40 years old person having reprimanded by his boss in who wife home he nastily behavior. So what is the example behavior? It is behavior of a displacement. So to correct, to remember this all the option we should carry out. We go to the next question about if a person having 20 years ESR is rises and sputum there will be negative, tuberculinum test is positive, probable diagnosis because tuberculinum montus test is positive, so pulmonary TB is our right answer. Next question, there will be thyroid nodule in a gal, no symptom. What is the most appropriate step we should do for the diagnosis? First, we should know what is the thyroid function test. Then we will go FNAC. Next question. What is the 5 years old male patient present with the hospital? There will be what we see granulomatous collection. Important is granulomatous collection, which is usually the multiple myeloma and Langerhans cell. We will confuse. Granulomatous is from in the granuloma in the Langerhans cell, whereas multiple myeloma there will be plasma cells involvement is there. So answer will be Langerhans cell histiocytosis because in the Langerhans cells there will be destruction is seen in the first decade and we see it is 5 year. Plasma multiple myeloma it is usually later age group persons are affected. Next question, sickle cell trait, the tumor we will get medullary variety. In the clear cell there will be proto-oncogene. In the papillary you see in the picture. Then NAGAL is the acute kidney injury biomarker. Then vitamin K dependent clotting factor is about 2, 7, 9, 10. So answer will be D. D is the right answer. Then it is coming from the your physiology part. So here you can I can say nasal body rough endoplasmic air 2. You can see the answer will be only if you match one then it will be occur. Then binding protein and function. As you know, ceruloplasmin, copper, transferrin, there will be transport of iron. So we can go with this. Then next question, there will be bacterial pharyngitis, internal jugular vein thrombosis, metastasis, which disease? It will be Lemire syndrome. Lemire syndrome is a oropharyngeal infection spread through lateral pharyngeal space causing septic thrombophlebitis with internal jugular vein. Then your pneumogram, as names pneumogram Hassan, so we will calculate the body temperature. Then next question, there will be concomitant symptom is the totality. What is aggravation and amelioration said by? It is the Robert statement. Important statement. I get Robert said that totality is the aggravation and amelioration of the symptom. Concomitant symptom में जो टोटलिटी कॉन्कोमिटेंट जो टोटलिटी ऑफ सिम्टम में है वो एग्रावेशन और एमुलेशन को डिनोट करते हैं. कौन बोले थे? रॉबर्ट बोले थे. दैट इज रॉबर्ट. नेक्स्ट क्वेश्चन अबाउट हाइनेमैन वेयर अपोजिम सेज दैट हाई पोटेंसी ब्रिंग आउट डेंजरस कॉन्सिक्वेंस. दैट विल बी 276 275 to 285. That is regarding doses effect. If a pregnant postponement of death sentence in a pregnant woman, the section 416. You should remember 416, 456 BNS. In a offense where punishable of the death happen, life imprisonment for more than 2 years, it will be warrant cases. Then a case of a respiratory failure, lobar pneumonia, there will be MDR, multi-drug therapy, HIV positive is there. If we say the death certificate will be issued on the behalf of a lobar pneumonia, because lobar pneumonia record immediate cause of the death. We should always record immediate causes. Where respiratory failure is a mechanism of death, lobar pneumonia is the first sequence, then MDR, then HIV. Light adaptation 20 minutes, dark adaptation 5 minutes. Both statement was, I think, correct, but not, it is wrong. Then medullary sponge kidney is always worst prognosis. It is not the right answer. Medullary excellent long-term prognosis. As the statement tells, C fiber slowest conduction velocity among all peripheral nerve fiber because it is thin and non-myelinated. The answer and the questions are. Then next question is that urine smell, cat urine, we know Kachuputam. So we can go with this A4. Next question is that hypericum, you know ST Joe notes. With this we can control. Next question, T-tester cough, Kali iode. Fear of death, it is a good number of medicine, but lac diflunatum does not have fear of death. It is from Allen keynote. There will be full of stomach but extreme hunger, sleepy throughout the day but remains awake all night. Body ache there is. The most indicated remedy is Tapisagram. So remedy that follows well after arsenonitricum metallicum, we go for arsenonitricum alumina, then Apisca helleborus, Baptisia का arsenic, then Berberis vulgarisca arnica. Next question from bowel nodules. There will be bacterial flora of intestinal tract. Is medicine prepared as a non-lactose fermentation. They are morbid product of disease. Here first statement is correct, but the second statement is not always correct. It is wrong. Then remedy characterized by thirstlessness. We know every ABCD. Apis, Ethuja, Apocyanum, Pulsatilla. Everyone not there. Only Apocyanum is not there. Everything is there. So answer will be A, B, D. Then Mercurius comes under which constitution? Your oxygenated constitution. Next question is that porcelain crucible. It is made of a porcelain. It is used in drying at a low temperature. It is not used for drying at a hard substance in a small amount of a high temperature. So answer will be answer will be A and B, not C. Low temperature it is not needed. Question from pharmacy. There will be storage of a drug in ambaric glass bottle and albaric glass bottle. That will be argenometallicum and causticum. Next also another question, if globule size 1 to 40 called as globules and more than 40 that is called pilules. pH का वाटर का कितना रहता है? वो न्यूट्रल रहता है. This is the video for the AIPGT 21 days where first question is that consider the following regarding human skeleton. Axial skeleton 80, appendicular skeleton 126, upper limb 64. So I go with the answer What is your answer? Please first pause and answer it. If not, then now the answer is 80 bones are present in axial skeleton, 126 in appendicular, and 64 bones in. So A, B, C. Next question. In osteomyelitis, direct infection spread by the hematogenous spread. What is the answer? Tibia, scapula, femur, or pelvic bone? That is, in osteomyelitis, the hematogenous spread is only by tibia. Okay. So tibia is the most common site of osteomyelitis. Now this is the unique question. Scapula congenitally high. It is coming from which part? Pediatric. It is a congenital part question comes. So here the answer will be Spallenberg deformity. Let's discuss how it is happened, so that we will remember for longer period. Next question is why ligament bigelow is for iliofemoral, deltoid, coracoacromial. Which one? That is iliofemoral. Next question that from BBC. The alcoholism is a rubric which is present in the BBC but not in Kent. That's come as a exam. D का 2 कहाँ पर है? Yeah, it is 2 options are there in D2, but heart C1 is in the option C. The next question is that aggravation summer, amelioration in winter belongs to which aphorism? Kent, the chapter acute and sensitive. Acute is on the hearing and sensitive is on the nose. Repertory of ovary, symptoms of ovary is written by C.M. Bogle. Next question is that hysomus is inciting. A का 3, B का क्या होगा आपका सीट का 4, A का 3, C का 4. That will be answer A. No. A3, B will be 4. Anxiety with paroxysm. Then Sidron is on the fear of friends and include sentimental diarrhea during. Next question is that symptoms indicated medicine fails to produce result in generality. Chapter which Kent repertory एक सिम्टम है इंडिकेटेड मेडिसिन फेल्स टू रिजल्ट. जनरलिटी में कैंट का कौन सी रूब्रिक ढूंढे के जहाँ से वो मेडिसिन का ये होगा? दैट इज इरिटेबिलिटी. इरिटेबिलिटी मीन्स व्हेन टू मच मेडिसिन डज नॉट वर्क्स प्रॉपरली. कॉन्ट्रासेप्टिव का एक क्वेश्चन था. डायबिटीज में कॉन्ट्रासेप्टिव मेथड फॉर डायबिटीज बैरियर मेथड इज द मोस्ट कॉमन कॉन्ट्रासेप्टिव मेथड. स्टेटमेंट 2 में लिखा था कि अकॉर्डिंग टू MEC HIV इन्फेक्शन contraception will be combined oral contraceptive pill can be used. So both the statement are correct. Bias SPM bias is a Kent control body. Bias is common. Lead time bias is most commonly associated with overestimation of survival time due to early case detection. That both statements are true. So hydrated cyst, we know it is the most common form of the enterobiva vermicularis, we remember. Then trichuriasis, that is bloody diarrhea, and you know that echinococcus granulosus is causes ankylostoma duodenale, that is iron deficiency anemia is the most common. Then echinococcus granulosus is causes hydrated cyst. Then next question is that lupus arthritis character symmetrical arthritis, joint destruction is seen, photosensitivity is seen. Small joints are not affected in lupus part. Small cell carcinoma, lung is caused as SIDH. Both statement 1 and 2 are question from gynae precocious menstruation questions. There will be fast menses before age happen. Physically psychological effect is there. There will be no effect of a final adult height. It is wrong. So answer will be A, B, C. Then gluteal hernia arise from lesser sciatica foramen. Sciatica hernia is arise from lesser sciatica foramen. Both are the 2 is incorrect. Sciatica hernia is not lesser sciatica foramen, but gluteal hernia is from lesser sciatica foramen. NHYS on the groin hernia classification. One triad called as Anderson triad is consists of a vitamin A deficiency, bronchiectasis, and a cystic fibrosis. 201 fifth edition issues of old school do something similar artificial ulcer. It is found in 201 fifth edition footnote. Cod soap is made up of interaction of solid animal fat with sodium hydroxide NaOH. There will be presentation of osteomalacia in adult is typical feature of a pseudo fracture. Hearing of flies walking on the wall is the feature of opium. Next question from surgery. Carcinoma of prostate commonly arises from peripheral zone. The secondary is affect the bone cell of osteoblast. Both the statement are correct. From ENT, there will be a cell which is seen in the condition of a rhinoscleroma. There will be gallstone, duodenal obstruction due to gallstone. Usually, bulb is Boisvert syndrome. Second most common cause of PPH is trauma. Medicines which are found in the guiding symptoms of a mathematical hearing but not in the nerve, that are aurum natronitum, iodoform, and ubausi.